Welcome back to VBuzz. You're still here with me, Swarna, and my co-host for the day, Ruben. Now we're into the second week of the Movember Grow a Mo and Save a Bro movement. Why aren't you doing it?
No, I just kind of think that I wouldn't look as good as some people would in a mustache or a beard.
I've never actually ever
Okay,
seen
you know
you
what?
with facial
For your
hair.
sake and the rest of the VBuzz gang, I'll do it one of these days.
Okay guys, we have something to look forward to, but facial hair is already once again set to be the biggest beauty trend on social media thanks to the 2017 edition of the annual mustache growing competition. Men across the world are sporting everything from handlebar stashes to the Hulk Hogan or the Charlie Chaplin on their upper lips. But in all seriousness, the Movember movement was first established to help raise awareness about men's health issues. And today we're highlighting an issue that's not really talked about: male infertility. Fertility specialist and gynecologist Dr. Agilan joins us to give us a little bit more insight into the condition. Hello, doctor.
Hello, hi.
Thank you so much for being here, doctor. And you know, a staggering stat that I gathered from a little bit of research that I did, was that about a decade ago, there was only 15% of male infertility cases that resulted in a couple not being able to conceive. But now, it's risen to up to 40 to 50%.
You're absolutely right, yeah.
Right, and you know, having said that, you know, how common is male infertility here in Malaysia itself?
Well, talking about male infertility in Malaysia, you're right to point out the figures. We have the figures from Australia, UK, and also the US. But unfortunately, in Malaysia, we don't have an exact figure. But I believe the figure doesn't run so much from that 40-50%.
Yeah, the global figure itself.
Yes, from the global figures, because from my own practice, among those couples who need an IVF, at least 40 to 50% is male-related. So I don't think so we are far off.
Wow.
But why do you think that stat has risen so much in less than a decade?
Yeah.
Well, I used to tell patients, I say that, you know, we talk so much about female health, right?
Yeah.
We always ignore the man, right? So over the decades, over the decades, actually men, I would say, has been poisoned. It's environmental factors.
Okay.
Yeah. When you talk about, actually, I would say environmental plus, yeah, of course, some genuine medical or genetic issues that leads to male infertility.
Right, we'll get to that in just a bit, but could you tell us what does male infertility actually mean?
Yeah, when you look into the definition, now let's say a couple is trying to conceive. Now if they have a difficulty conceiving and the main issue is male related, that's called male infertility. Now if you look into this, you can divide that into two. First of all, men who purely have sperm production or sperm quality issues. And of course, the second group is those who actually can produce sperm, but they suffer from sexual dysfunction or sexual disorders. Yeah, this is male infertility.
Right. How do you actually diagnose it and you know, to find out?
Okay. The couple actually goes through few stages before we come to a diagnosis. Now, first of all, it starts with an interview with the couple. From it's a history taking, medical history taking. So through the interview, we'll get to know what is their main issue. Then they'll go through some investigation, some examination, and one of the investigation is a sperm test. So through the sperm test, I will know whether the man is suffering from male infertility.
Right. In your opinion, is this interview process something that's difficult? Because you know, it's hard for people to talk about things like this and you know admit perhaps.
Yeah. Usually the wife will come in, right? By the way, they'll drag the husband to come to the clinic. So,
the common cases.
Yeah, that's a common case. So always tell people that if you're starting what do you call assessment for fertility, both of you have to come at the same time because most of the tests, I agree, is focused on the female. Yeah, one test, which is a sperm test, focused on the male, but at least 40% of the reason is male related. So you can't ignore the man.
Yeah? Right. But doing the sperm test, what does the semen analysis tell you?
Okay, semen analysis is a test where we look at the semen under the microscope. Yeah? So what we analyze is what we see under the microscope. There are few parameters actually that we look at based on the World Health Organization. But the most important are 4 parameters. First of all, is the amount of sperm, which is concentration. Okay, that's the first thing. So that tells us whether the man is producing enough sperm.
Correct.
Okay. The second thing is how many of those sperms are alive. Yeah, he can have 100 million sperm. Yeah. But what if it's only 5% alive? So he'll have an issue, right? So that's the second thing we look at, viability, or also the motility, the movement. So that's the third thing we look at. So the sperm have to be moving. That means they are alive. It's an indirect indication that they are alive. Yeah?
Okay.
And the fourth thing is, not only they should be moving, but what's their direction of moving? What is their speed of moving?
Wow.
Right? Because the sperm, right, it's a clever thing. Right? Sperm have to actually move and find the egg. So
Right,
if the
yeah.
sperm is, let's say, even if it's an Usain Bolt, yeah, but if it's moving in the same direction,
Or
it doesn't
Michael
mean
Phelps,
anything.
perhaps.
Yeah, it doesn't mean anything. The sperm have to move in the right direction.
right.
These are the most important parameters. Of course, the next thing is how many of those sperms are normal looking. Right?
What do you mean by normal looking?
Actually, sperm got 3 parts to it,
Okay.
just like a human.
Okay.
They have a head, sperm got a head,
Right.
tail, and neck. So when you look under microscope and these 3 structures looks normal, we say it's a normal looking sperm.
Yeah.
Right? When any of these parts are abnormal, it's an abnormal sperm.
Okay.
So abnormal sperm not going to do its function.
Okay.
So
Right,
it
but
gives rise to male
I'm just trying to
infertility.
imagine, there are millions of them.
Exactly.
I know it's microscopic, you look at it through a microscope, but there's so many of them for you to look at to decide and see. So it's quality over quantity at the end.
It's both, I would say. It's not only the number game, it's also the quality game. Yeah.
But speaking of the number game, just now you mentioned 100 million,
Yeah,
like
yeah.
it was nothing. I mean, that's insane. What's the normal sperm count versus one that's low?
For a
What's it
healthy
supposed to be? Yeah.
guy, perhaps.
Okay. Now, based on the current worldwide standard, based on the WHO 2015 guidelines, a sperm count of 15 million per 1 milliliter of the semen is considered normal.
Okay.
So, but they are also considering or revising it.
Okay.
There's some studies are coming up and saying that even a man can have 30 or even 40 million sperm per milliliter, it still can give rise to male infertility. So in future, I feel, in the next few years,
Wow.
probably the standard is going to be higher.
Okay.
Yeah, so
Right.
anything less than 15 million sperm now is considered low sperm count.
Understand. But so what are the factors that contribute to healthy sperm?
Okay. We'll say if it's a healthy sperm, yeah, probably I'll answer it in a different way. Yeah?
Okay.
What actually contributes to unhealthy sperm? So it's a bit more easier to understand, isn't it?
So we are all
Okay.
born with healthy, I mean, we
Yeah.
we have healthy sperm, but what makes it unhealthy is...
Unhealthy, yeah. First thing is I said environment, right? I said the men are being poisoned.
Yeah.
So if you're talking about environmental factors, it's like, first of all, smoking.
Okay.
Smoking for years has been known to reduce sperm production and quality.
Wow.
Okay.
Yeah.
Okay.
So number 2 is alcohol.
Okay.
Too much of alcohol actually reduces sperm production. Basically, too much of alcohol, it actually reduces the male hormone called testosterone. You need good amount of male hormone so that male factory, sperm factory,
Yeah.
which is testicle, can produce sperm. Yeah. The next thing is diet.
Okay.
Poor diet, which
Okay.
leads to obesity.
Right.
Right.
Okay, obesity basically in a man, it increases female hormone.
Oh.
So
Oh,
always,
wow.
yeah, it increases because a lot of fat actually converts male hormone to female hormone.
Oh, wow.
Now that actually directly reduces the amount of testosterone.
Right.
So you can expect poorer sperm production.
Apart from these three, doctor, what about genetic and aging issues?
Okay, well, yes, it is. They contribute, for example, let's say genetics. Some men, yeah, they are born with certain genetic condition, for example, Klinefelter syndrome, where they do not produce sperm, or sometimes they produce very small amount of sperm.
Right.
Okay.
So in their semen analysis, we
Okay.
see zero. In fact, they are producing some which is still in the testicles. Yeah.
Okay.
Yeah. And also medical conditions.
Right.
Also leads to a poor sperm count. For example, uncontrolled diabetes. Poorly controlled diabetes reduces the sperm quality. Poorly controlled thyroid problems. Poorly controlled high blood pressure.
Yeah.
Right. What about radiation? I've heard a lot that, putting your laptops on your lap or kind of
yeah.
keeping your handphones in your pocket also affects your sperm count.
By the side of your bed.
Okay, to be more precise, that's not radiation. I think you're talking about heat.
Okay.
Yeah, increased heat
Okay.
Okay,
has
so
been
that's what
shown
it
to
is.
Right.
reduce sperm count and also quality. But again, talking about handphone, some studies say yes, some say no. If you say laptop on the lap, some said yes, some said no.
Right.
End of the day, if you look at all the studies, we don't have a clear conclusion on what to do. But
Okay.
the end point, I mean, the point that we know is that if you increase too much the temperature around the testicle, it's going to reduce the sperm count. That's why naturally the testicle is outside the body because the body temperature is higher.
Right. Okay, but if you also mentioned a lot of lifestyle details that can affect
Yeah.
sperm count. If we were to combat that issue, what kind of foods do you think would help boost
Yeah.
sperm count?
This is a very good question, actually. Now, if you talk about food, So far, there is no magic food.
Okay.
Okay, let's put it that way. Yeah, if a man can maintain a healthy diet, yeah, and he can reduce smoking, reduce alcohol,
Yeah.
that will greatly help to improve his sperm production and
Okay.
count. The other type of food is actually supplements. We're talking about supplements,
Okay.
like vitamins.
Multivitamins.
Yeah, multivitamins, to be more specific, antioxidants.
Okay.
Now, people take vitamin C, right? I'm sure a lot of people take vitamin
And
C.
there's a lot of fruits as well that are
Yeah.
antioxidants, right?
Yeah, correct. Fruits, a natural thing, like anything which are red, strawberry, cherry, all contain a lot of antioxidants. So antioxidant, this group of vitamins improve the environment for the sperm to mature properly so that it can give rise to a better quality sperm.
That's interesting. But you know, you mentioned, doctor, that there are two parts to infertility. There's the sperm count, but there's also the mechanical dysfunction aspect.
Yeah.
Could you tell us a little bit more about that aspect?
Yeah. When you talk about mechanical dysfunction, basically it means the sperm is not doing its function. Okay, the sperm can look perfectly normal, it moves pretty quickly, but if it's not doing its function, that's mechanical dysfunction. What's the function of the sperm? Find the egg, penetrate the egg, and fertilize an egg.
Okay.
Okay, usually this happens in those with a very poor quality or when they have abnormal shape of the head of the sperm.
Oh, okay.
Because head of the sperm is very important. It contains certain chemicals to break through so that it can enter the female egg, to break the wall.
Right.
Yeah, so usually it happens in an abnormal sperm.
Right. Okay. What about scenarios where, you know, there are injuries to the male reproductive organs? You know, can these sort of injuries, you know, dictate or affect male infertility?
Yes, it can. It can. In fact, in two ways. One is reduced production.
Okay.
You're talking about injuries, let's say sports injuries,
Right.
or even any infection that leads to, it traumatizes the testicles. It
Okay.
can reduce production of the sperm. And number two, sometimes it actually blocks the pathway, the migration pathway of the sperm.
Okay.
So if you have an injury and then that pathway is blocked, so no matter how much of sperm you're producing, you're going to see zero sperm in the ejaculate
Right.
anyway.
Right.
So
Right.
this
Is
so
it specific to the groin area or?
Well, it can. Sometimes if you're talking about groin area, people have gone through hernia surgery.
Right.
Yeah.
Right.
If they've gone through hernia surgery, sometimes during the healing process, if the certain blood vessels are blocked in that area,
Right.
it affects testicle.
Right. Wow.
Right. So we've talked a lot about the causes, but is there any treatment for male infertility? If so, what does it involve?
Okay, it is. There is treatments. Now, if you talk about treatment for male infertility, right, there are two groups that you're talking about. The first group is the man who's already producing sperm, but the poorer quality and count.
Okay.
Right.
What we can do to them. Of course, the next group is there is no sperm. There are two
Right.
different groups. Now, we talk about the first group, yeah? So first thing is, as a doctor, usually our job is to see, can we do something to make the man to produce healthier sperm? What we
Yeah.
do, lifestyle modification again.
Yeah.
Yeah.
Smoking, alcohol, weight control,
Okay.
stress
Okay.
control, yeah?
That's what we can control, right?
Yeah,
On
that's
our
something
own.
that you can
Yeah.
control, plus healthy diet, vitamins, supplements. Some of them do need certain tablets to try to push the production of the sperm.
Okay.
Now, if they have a better quality sperm, some of them do get pregnant naturally,
Okay.
right?
Okay.
As a fertility doctor, we want them to get pregnant,
Yeah.
whichever simplest way
That's the end
possible,
goal,
right?
yeah.
And that's the end point. Some of them need simple treatments, like an IUI, intrauterine insemination, where
Yeah.
sperm is processed and just injected into the womb at the
Okay.
right time.
Okay.
Yeah, but of course some of them do need a bit more sophisticated treatment like
Right.
IVF, yeah, in
Understood.
vitro fertilization.
Right. But it's scary, doctor, because sometimes, you know, when I'm surfing the net, I'm watching a YouTube video, for example, and I see all these ads pop up, you know, about forms of treatment that can be done and whatnot. And there are different forms of treatment that, you know, I really don't know about. Should I be wary or be careful or, you know?
Well, I assume you're talking about supplements that are sold
Yeah,
in
yeah.
the net, right?
Exactly.
There's so many. There's so many
Yeah.
of them. We don't even know what they are contained. Some of the supplements which are legally sold, public mistaken it to improve sperm count. You have to read carefully because some of the supplements contain male hormone. Yeah, or substances
Understood.
which actually acts as a male hormone.
Yeah.
Now, when you take those in, it actually stops the man's own system to produce the sperm. So some of them have taken the testosterone without realizing it, and then when they come in, the sperms are zero. They say, oh, doctor, 2 years ago I checked, I had about 20, 30 million. Now, why is zero? So that's why the interview is very important. True that we're able to identify why this happened. Yeah?
For
So you have
sure.
to be very careful. A lot of supplements are not
Yeah.
tested, so you got to
Yeah.
be very careful what it is.
Right,
Yeah,
right.
yeah.
Okay, be careful lah.
Yeah, the doctor, in the start of the interview, you mentioned that a lot of males are very reluctant to come and seek treatment or even get diagnosed. What would you say to encourage them to do that and maintain, you know, their healthy bodily function?
Well, first of all, is again back to education. We got to educate them. It's not a taboo thing anymore. Yeah, I know. First of all, infertility is already a taboo factor. Taboo, right? People don't talk about it, isn't it?
Yeah.
Now, when it comes to men, it's even more difficult. Yeah.
Yes.
First of all, they have to put aside their male ego.
Exactly.
Say
It's a
that-
macho thing, right?
Yeah, you just to put it aside and say that if you're going to have a baby, it's a two-way thing. It's between me and the wife, and it's both of us are involved in it. Come out. If it's a male issue, it's good for you to know it earlier than later, because you're going to put through your wife through so many unnecessary investigation, unnecessary treatment, later to find out the issue is actually you, right?
That's so true.
First of all, just to make sure, come in early, check, and also that find out if it's a male issue, then tackle it. Once you know there's a problem, at least you'll find a solution for it. Yeah.
For sure.
Fantastic. You know what, Doctor? Thank you so much for your time. We really appreciate you being here, giving us all the answers related to male infertility. Thank you.
Thank you
so
very
much.
much.
All right, and there you go. What I took away from it is the fact that, you know, we should drop our egos and, you know, just make sure we go and sort this out. Yeah, because like he said, you know, it's not a problem where it's affecting you alone. It's
Exactly.
you and your wife and the fact that you know, you're struggling to conceive. And
Exactly, and you need somebody to carry on the legacy, and it is not at all something that should be considered a taboo
Nothing to be
for you
ashamed
to-
for.
Exactly, exactly.
Yeah.
Anyways, that was a very enlightening conversation. I hope you guys took something away from it. Right after the break, though, we will get the head coach of the Malaysian Association of Dodgeball, Albert Tan, in the studio, so don't go anywhere.